Hi. Hi, everyone. After a virtual presentation like this one, it's so delicious to be in touch with three great and special women. I would like to say good afternoon to everyone. My name is Claudia Kahn. I work in the healthcare sector for the last 32 years, and to talk on innovation in this virtual platform is great. And it's a provocation for all of us in the healthcare sector. This conversation is a very informal conversation with a topic that I love. And we will talk with these great women, super special women that have been already been introduced. Jihan, Galia, and Paula, they have been introduced. But to kick off our conversation in a cozy way, I will start with one question to heat up our engines and to introduce some topics for our three speakers. So before we start, I would like to thank you. Thank you all greatly, and thank the organizers and Comea Innova Summit, because this initiative is great, fantastic. If you haven't visited the site and haven't seen the Health City, go in, visit the platform and the site, because it's great with a lot of coverage topics that are very interesting for you to take advantage of. It's an inspiration for each one of us, no matter how old you are or area of expertise. All of the areas are covered in this city of healthcare. Three important topics: women, technology, and health. We cannot talk about these three topics without talking about the moment we're living globally. When I started working in hospitals in the area of diagnostics, we lived so many things. I remember it was AIDS in Brazil, AIDS in the world, and so many pandemics and epidemics that come and go and sometimes leave us as hepatitis or silent diseases. But COVID-19 has brought information for communities, societies, and with more information, communities ask more questions, become more demanding, apart from the change in our lifestyle because of the pandemic. So when we talk about healthcare technologies, we're talking about a very unique moment. We're talking about a moment nobody was ready for. I repeat this, nobody saw this coming and nobody was ready to seize the moment and restructure ourselves for a possible first wave, second wave, or what happened, the second wave, the third wave, and who knows what, and how many topics in this pandemic. So there's nothing better than women, such special and diverse women, to talk about all of these topics. Healthcare is not only about the pandemic, and it's essential to exchange information, because deaths, diseases in different regions in the world are the consequence of the lack of prevention, sanitation, healthcare, and become chronic diseases or epidemics that the world goes through with shattered economies because of these situations. But it's not because of the healthcare sector, it's because of neglecting the healthcare sector. So I know we could talk about this for hours, but we will talk about this for some minutes, precious minutes. Let's start with Paula. Paula. Hello, Paula. Thank you for being here with us this afternoon. In 2 minutes, tell us, what about your career? And I will summarize the first and second question. Your career as healthcare professional and what you see today, you as a woman, what is your added value as a woman, as a wife, girlfriend, daughter, mom, whatever, as a woman, what is your specific contribution with your journey? Thank you for being with us today. Hi, Claudia. Thank you. It's a pleasure to be here. Thank you very much. First, well, I'm here with my friends Jihan, Galia. It's great to be with you here today. And first of all, gratitude. Thank you, FIS Initiative, for the invitation, for this special invitation to be here with you. So I'm a medical doctor. I'm a general surgeon. I have worked in the healthcare service and trauma, and my development has been organic because I lost sight of one eye and I migrated to public administration and developed programs that were very well known in Sao Paulo. I did this in the south of Brazil, in Curitiba as well. And ultimately, in this search of problem solving, my mind focuses always on solutions. I never talk about problems. I talk about problems, problem solving, innovation, technology. And here we are together today. What is the added value of being a woman? Well, the holistic approach, a multitasking, holistic approach, different from the masculine perspective. All of us, Claudia, you know, Galia doesn't know about you, but we have been together in male-dominated environments. So to contribute with a differential, an added value as a woman with a more complete thing, multitasking, doing 10 things at a time, this is our added value that puts us here in this position. Today, I'm with the challenge of working in the ID health network with different possibilities. But this holistic approach is our feminine added value that puts everything together in perspective. Great.
This special mind brings innovation all the time. Women are increasingly in this innovation. Looking at your journey, Galia, I'm going to speak Portuguese because Galia is listening to English. She is from Israel and she's listening to English. That's why I'm not going to speak English, because she's listening to me in English simultaneously. So you can all understand. Galia, your journey as a doctor at a state-of-the-art hospital, what do you bring in your journey looking at a possible or not transformation? How do you contribute to technology and healthcare together to make a difference in the world?
Okay, so thank you very much. I'm really honored to be here, and I thought I would be the only physician and not technologist in the group, so I'm really happy that Paula as well is a physician. And I think it's an advantage to be a physician because you understand better the needs and you understand better the difficulties in transforming to digital care. So I'm a pediatrician. I'm a pediatric infectious disease specialist, and I'm also heading the pediatric infectious disease unit in Sheba Medical Center, which is the largest hospital in Israel. It's one of the top 10 hospitals in the world, according to Newsweek, for already 3 years in a row. So I until 5 years ago, I was in a career that was really, really clinical. I treated patients. I worked in a pediatric wards, and I was a consultant as well. And I saw myself in the clinical area all the time. But then, by mistake, I got to the field of telemedicine. I really quickly understood that it's the future of health, and there's a lot of value in it. And I think what happened then is that I grabbed each opportunity that was given to me. That's, I believe, the main thing that led me to continue. So as I told you, by mistake, I got to a meeting, interdisciplinary meeting, to which my boss couldn't come. And they were talking about a new project of telemedicine. I don't remember what I said there. In the end, I said, you know, this is the future of medicine. And about 3 minutes later, my CEO, I think it was the first time he met me, he called me and I said, we decided to go on this project and I want you to lead it. And I immediately said yes. I think this is why I'm in this. And later on, we developed some new projects. And then he said, you know what, you should lead the whole field of telemedicine in Sheba. And we did some really interesting things. But until COVID-19 came, it didn't become the main frame of telemedicine, the main business of medicine. It was just a side thing. And really, COVID-19 changed a lot of things. It was really transformative for the whole world, but especially for the healthcare world. I think the needs changed. We, for the first time, wanted to treat inpatients using telemedicine tools. We didn't do that before because the thing was to protect medical personnel. And we also had lockdowns where people could not come to the hospital or did not want to come to the hospital. And we transformed all our clinics to video clinics. So we did a lot of things. And also there were many regulatory change, reimbursement models changed, and users got used to do things from distance. And that's when Sheba decided to establish a new organization within Sheba. Sheba is a big medical center with small hospitals, and to establish a true telemedicine hospital. This is what I've been doing for the last year. And our CEO gave me, the mission of establishing this hospital. And he thought he would bring a CEO to the hospital. And then I told him, I think I should also lead this hospital. So just talking about women, I think one of the things we have to do is just, to dare and say, I want this job. And he did give it to me. He said, well, I didn't think you'd want it. So I think one of the things is to seize the opportunities to take in and even take one step forward. I think this is my story.
Very good for us to know. I am suspicious to talk about Israel. Can you hear me? Yeah. But Israel, let me tell you, the world knows that it's been an example in various technologies, and especially in healthcare at this time. And now I'm going to bring a person that is a reference in telemedicine here in Brazil, Jihan. I say that Jihan, I can send Jihan, and my surname is Kohn, and everybody says Kohn. And I can pronounce your name correctly because I have the same problem with your name. So it is a pleasure to have Jihan here. She is in South Brazil at the moment at a hospital. She's in the hospital. She just took off her mask to talk to us right now. And I'd like you to share with us a bit of your journey and your transformation that adds value as a woman so that we can move into the focus to inspire other women that are here with us. Your journey and what you have been adding to this telemedicine journey, and that you, like Galia, have been running here in Brazil, you in Brazil and she in Israel. Cool. First of all, I'd like to thank FIS Initiative for the invitation. It's a pleasure to be with you here. Claudia, I admire you greatly. Paula, very much. And especially having her in the market, Galia. We know Galia as Israel is a benchmark in the world. I still wish to go to Israel and get to know you personally, Galia. I'm going to share my journey with you. So as a woman, we have lots of inspirations from other women. I never looked at gender, female and male. I always looked at the goal of what we have to do. If you look in details, we don't move. So I have a degree in math and Bariushi, and I left my village in Lebanon at 17 to study. I think I was the first woman that left from a village to live on my own to study in 1991. And then that was actually a break or a disruption in the routine of people that live in a village. And then I studied maths, and then I married a Brazilian man. And I came to Brazil and I joined IT college, and then I did my master's at the São Paulo State University in computational sciences geared to medicine. So I kind of had to bring down all the barriers, language, cultural, everything. When you are a woman and want to do something, when you really want to, nobody can stop you. No one. We were born free, and we want to do, and we have to do what we want in life. So at the end of my PhD, I was working at a trade show in Sao Paulo, radiology journey. And I saw there were many international images in Brazil. We have many creative, intelligent people. We don't have something that is national, that is representative. So I started my journey to become an entrepreneur in telemedicine, bringing taboos down, having all the images on the cloud so that radiologists could access, use the image, make the report, and actually discuss cases amongst themselves, because till 2020, it was not allowed to have a doctor's visit. So not the first visit, it was just for the second visit. So when the second opinion was something that was quite complicated. I think we were the first startup in 2019 in telemedicine. When telemedicine started in Brazil, we were the first to buy the space at the trade show. The people told me, I didn't know that. No, this is going to happen. This is future. If we don't fight for this, we won't be able to make it happen. We started testing, using it, because I say the following: the human being is the enemy of the unknown. When you know something, you can judge. And then COVID pandemic came to teach everyone a lesson that telemedicine can be done. It works. It helps many people in a country like Brazil, demographically large and geographically large. So there are very remote regions. We know that 50% of doctors are in Southeast region. What do you do with the rest of Brazil if you don't use technology for you to be able to deliver healthcare? You cannot evolve in Brazil as a whole. People are healthy, can work, but people that are not healthy cannot work. So we have this path that we start to see. And then we started. The first case that we cared for was in March in Porto Alegre. I'm actually here at this innovation center in Porto Alegre, south of Brazil. We did it with 4 hands. We set up a platform from the patient's journey, so making an appointment, journey of the patient, exams, tests, etc., and next visit to doctors. And then we were concerned about helping the hospitals, because of COVID, to retain their patients, to actually care for them at home. And we saw how wonderful it was, regardless of their social level, age, and gender, they can do that. So I am a mother. I have 4 children. I work, I study, I do everything I can, and I don't waste my time without anything. Sometimes I can have some fun with my children, but we're here to help to make a digital transformation in Brazil as a whole. Thank you, Claudia.
It is great to listen to this, and I will change the order. I will start with Israel. And one of my best friends is from Lebanon, and she says that women must believe in themselves of all things, regardless of where you live. And men as well. Come on. Okay, so what I want to share with you is this. Galia can tell us about this. And she will tell us how the story goes in Israel. I have great friends in Israel. I know some things in Israel. I know that there are hospitals in Israel. And Shihan, you mentioned that. It doesn't matter who you are. For instance, in Daza, if I say, for instance, you have a man treating a woman, a Palestine person treating a Jewish person, or the other way around, because health, as music, unites everybody. There are no differences nor borders. Everybody is equal. So the basis of healthcare, 70% of healthcare, 70% of the basis in healthcare services are made of women, but heads of teams, team leaders, well, the pyramid gets narrower and narrower. Management, less women, VPs or superintendency or higher up in the ladder, less women and women. And then there on the top, VPs, president, CEO, less. This doesn't really change from country to country. Some countries even, and you believe it if you may, I was studying this 2 weeks ago. I was getting ready for this meeting because FIS initiative asks us to get ready and study. There are countries in which men are paid to work in the healthcare service and women work for free. Today in 2021, this still exists. Women working for free. So I want to listen to you. A very short question. So we go to the topic technology. Just a very, very short answer. What's the role women have in health? What is the role you play as accountable for inspiring other women, as you're doing today, but in your daily lives? What do you do to make a difference for women? What's the role of women in this wide difference I mentioned? And what are you doing to change? Galia, would you like to tell us about Israel and about you, your story?
So in Israel, it's about the same. About 65% of healthcare personnel are women. So the majority are women, and indeed, less and less women. You can see less and less women as you go up higher on the hierarchy. For example, in Israel, we have 33 hospitals, and only 4 women are CEOs of hospital, and it's also a big change because until now we didn't have women being CEOs of hospitals. So that's a big change, and I believe every management, every organization needs diversity. It's not only women, but you know that companies perform better when there is diversity. So I think one of our major roles is to bring diversity to our organizations. And that's why women have to be heard and have to be present there. Because there are differences. I cannot say women are better. They bring other aspects, other ways of thinking. They're women, so it's different, and it's really important for them to be in the management of hospital and in healthcare globally. So I think this is one of my roles, and I know as a pediatrician in Israel, we have many pediatricians that are women. Most of the pediatricians now are women, but again, heads of wards are usually men. Heads of hospitals are usually men. So I really think it's important to be heard more. In Israel as well, our salaries are less are not as high as men's salaries. This is something we have to go and make better during the future, and that's one thing we do. But there is a gap between men's salary and women's salary even in Israel, which I think is becoming more and more liberal in this aspect. But still, we have a way to go. I also have 3 kids, and I raised and I grew my 3 kids during my whole years as a medical student and residence, and specialty and subspecialty, and another subspecialty in health management. So it's a challenge, and I think yes, it's more challenging for women to get there. It's more challenging for women to get there, and they have to make a bigger effort. But it's possible, and our voice needs to be heard there.
Very good. Something for us to keep here. First, it is possible. Second, I brought up my children during my residency, 3 children. So if you are in doubt of what to do, when to do, you can get inspiration from this. And if we have heard this, Paula, I'd like you to share the answer of the second question. Do you want me to repeat or can you go ahead? I took note of it. So what defines me as a woman today? This is a phrase. I'm an activist of healthcare access. People must have access. We live in a country where 80% of the population has no health insurance, totally dependent on the public health system. They must have. It's an obligation for us to create more access. I think the major skill. Women have lots of soft skills. By nature, we are carers or caregivers. So we have from the time we are born, so when we are there to care for patients with empathy and carefully, and we do it differently with a different mindset that is maternal from the male world that is more rational, more objective. And we bring that with the purpose of expanding access. This is my drive today as a woman, to bring this female care with this activism of expanding access that is more than necessary to our country. Have I left anything out, Claudia? No, I think you have brought your role as a woman and what you're doing today. Today, you are a leader in the FLEUDI group of clinical analysis that has taken innovation and technology as a channel for the possibilities of what you have been doing. And Galia has told us about the journey that as a woman, the responsibility of a woman is transformation in Israel. And when we say this phrase is becoming famous, diversity is not inviting people to the party. It's actually calling people to dance. All of you dance, even if you need to dance on your own. This is the point. It's not the ball. It's actually how you're dancing to the tune. This is a great inspiration for women. And in our last 15 minutes, I would like to hear Jehan to answer the second question and for us to board onto the technology world and talk a bit about transformation. Healthcare, pandemic, and transformation. But before, I want to hear you. Nice. I see myself as a woman that holds up the flag of technology in myself. So I am very proud to give this example to my daughter. I have 1 girl and 2 boys. My boys are going to have a girlfriend and a wife, and they will actually live with women. So at home, I do this with all the pleasure. I set this example. This prejudice that women don't know math or technology, I say it's not. Women can do it. And currently, I have one of the position as CEO in my company, founding CEO, 15% of startup CEOs women. I'm expanding that, actually hopefully inspiring women to do this in Brazil regarding this. I'm also manager of CIS. It's a voluntary organization to disseminate technology and health. And I say that the flag is to democratize technology, and healthcare comes right after that. So I have Galia, Paula, in this journal, like you, with the 3 of you and Paula. And the second question was that? No. Was this? This was the first answer. You brought a bit on your journey as a woman and your responsibility. What you brought here is clearly that to you, women, both in healthcare and technology, and in technology even perhaps less. I am a biomedic, that we have 2 doctors, 2 physicians, and 1. You have degree in technology, right? You must have faced even more difficulties because in technology, the disparity between men and women is even greater. But the great point, I agree with you when you started, is that it doesn't matter your gender, your sex, your option, or whatever. What matters is what you fulfill, what you deliver, what you do, and what you take with you, and what you generate in terms of value. And then in healthcare, we have many innovations and startups taking off, many innovations at the very difficult time for our healthcare. And we have countries like Israel that have opened up and are running an almost normal life, so to speak. And we have Brazil, which is the 5th country in the world in terms of vaccination, but even so suffers a run that it is possible to have mutation to other variants, and the mutation to other variants may win mass vaccination. And that's why we have astronomical numbers, even though moving towards to some stability with various vulnerabilities. And we have other countries that need to have access, data, technology, and healthcare. Healthcare, sometimes basic or primary care, as we are going to talk. How can we talk about genetics or AI in a country in which 20% of the population dies from infectious diseases caused by lack of basic sanitation? So we have these various realities, and technology could be a means to contribute to health so that they can move hand in hand to help that. I'd like you to bring, since we have 12 minutes, each one 2 minutes, and then we close. What would you bring at hand to change the world today using technology in healthcare? In addition to what you've mentioned, telemedicine, what would be the step that the governments and that organizations could take to contribute for this great transformation, since we are in this virtual city of health? Now I'm going to start with Jihan, okay? Let's go the other way around. Sure, Claudia. What can we do? We can help develop healthcare ecosystem as a whole. When I talk about health ecosystem, not only startups, hospitals, operators, managers, investments, innovation hubs, mentorship, cultural changes as a whole. We still have a lot of serious problems in Brazil, which is the cultural education part. It's no use for youngsters to innovate if there are no gray-haired people supporting them. This is very important. I usually say that it's no use for startups to go to hospitals offering a service, and the hospital want to smash startups, pay a cheap price for a much better service than a renowned company in the market. So the ecosystem as a whole has to be aware that it has to go through a digital transformation. It hurts. It is hard. It requires work, cost, investment, suffering. For you to transform something for the better, you have to spend and invest in everything. It's not only convincing people, that's my word, to actually deal with the ecosystem as a whole to make real changes in the healthcare. So I'm speaking quite fast, but it's okay. Very good, Jihan. So here we have some terms for us to keep in this suggestion for the great transformation. First, looking at the whole ecosystem. Second, investing. Nobody will reap benefits if you don't invest. Galia, up to you.
So I cannot not agree with Jihan. Investing is one of the most important things. Governments have to understand, they have to invest in it, and it's usually a lot of money. But I would say one of the major things, to do a digital transformation needs an adaptive change, and this is something that takes a lot of time to change the way our mindset, the way we think healthcare should be delivered, to believe that it's actually telemedicine, for example, is not a constraint. It can bring a lot of value. We can monitor patients between the visits and get a lot of data between the visits and objective data that we usually don't have that can help us a lot, giving good medicine, better healthcare. So this change is adaptive and it takes time, but what I think should be done is for governments to invest in infrastructure. We need to have very good connectivity, especially in a country like you in Brazil that is very big and many people live in the suburbs. First of all, they have to invest in infrastructure so everyone can have access to digital tools, and then the rest will come.
Very good. Now we're talking about triggers. Galia brought an important point to us. Infrastructure is a trigger for us to reach our goals, just as connectivity to all. That's another trigger to help healthcare with everything Jihad has brought. Let's keep it all, because those that are building something now, the focus, discipline of looking at these points certainly will lead you to a different future. Paula, up to you. Well, putting this answer into two parts, I think the suggestion for the government is that we should foster public-private partnerships more. So we should have people accessing public health systems, private health systems, sharing data and everything. My suggestion to governments is do not want to do everything on your own. The private sector knows how to do it. Let's do it together. Let's foster it here. Why not, as Luisa Trajano is doing, public-private vaccination? Why do both worlds have to be so separate? If we move together, don't we get there before? Together, can't we gain speed with that at the time we need it? Regarding organizations, me and Jihad have talked a lot about this. This decade is an ecosystem decade. It's not ego system. We must have collaborative systems from the time that we start uniting, looking at other industries that have much more advanced technology than ours, logistics, delivery systems, and other platforms that are already mature in terms of their market. Air business, tourism. We have to look outside, learn from outside, bring in-house, build ecosystems, not drive to business competitions that used to happen in the previous decade, drive up for us to have collaborative ecosystems and learn from other industries. I think these two tips for us to attain digital transformation. Government, public-private integration, companies, ecosystems, and collaborative systems. Very good. I'm going to combine everything and add to what Paula said. Jehan brought some important points: investment and technology. I am summing up to you that have taken note of a lot of things, important terms Galia brought up. Infrastructure, that is very important. Connectivity. Paula brought up collaboration and partnerships. 2 points from each one of them that I have summarized here for you, so that we have in our last 5 minutes, I'm going to thank in the past 10 seconds, and I'm going to ask now, starting with Paula, a closing remark of optimism or realism or pessimism, whatever you like, as to how are we going to continue in this future so that health can be held to everyone in an appropriate way, regardless of the access and the place in the world where the person is. I'd like a message from you, one from Galia and one from Jihad, a final one, and then I wrap up so that we can be punctual as we've always been.
Thank you, Claudia. I was thinking about women, transformation, innovation, and everything related to technology. It is a tip. Marie Curie, 2 Nobel Awards. It's a movie I just watched. Did you watch it? The first Nobel Prize that she won, it was given to her husband. First because of radioactivity, and then a Nobel Prize award for chemistry. And her daughter received another Nobel Prize. We're talking about the 1900s. She was able to bring about these transformations, being a woman in such a male-dominated world. How come we are not going to make it and bring all the innovations and the debate to this current moment? It's just an optimistic message. There's no way we will be negative or pessimistic. What happens around us will never get to us. Watch that movie. You need to watch that movie. And we also have here in Brazil stories of great women. We know about the Sehered Foundation, Helena Sehered, that left the foundation and did great things. She was a pioneer. And even at that time, she did great stuff. So this is my take-home message. Inspire in these great women. Inspire in us, because we're all together pushing the bandwagon and trying to work in this collaboration. Thank you very much for the opportunity and the invitation. Great. Galia.
So I can refer to Paula saying before, talking about collaboration. I want to say it was a big honor for me to be in the same panel with Jihan, who comes from Lebanon. And for me, it's really a great honor. I think healthcare especially is a very, very good bridge between people. And if you come to our hospital, you can see that we do treat Arab, Palestinian children sometimes. We have Arab, Jewish doctors, nurses, and really, if you come to a hospital, it's a microcosmos of world peace in the world. So it's been a great honor, and I would like for us to continue collaborating between people around the world. And thank you very much.
Thank you very much, and it's very nice to hear you. I'm Jewish, and so is Galia. So we are in a world where we could see so much hatred, and we are here sharing and conveying this, that people should be inspired in this, not only in religion, gender, race, everything that you see, because everyone is a human being. Jihan, please, up to you. Very nice. After Galia, Havana said, I have nothing else to say. We said everything. So thank you very much. It's been great being with you here in this panel. I usually tell women, don't wait for somebody to fulfill your dreams. Do it yourself. This is my great advice. You go after it. Nobody's going to do it for you. If you wait for somebody to fulfill your dream, nobody will. Thinking about what Paula said, women in history, and even men as a whole, this is a very good thing for us to inspire ourselves, optimist, positive, creative people that do good. That's what makes us being different human beings in this world here. Thank you, Claudia. Very good. I'd like to thank you three very much, Jihan, Galia, and Paula. Sensational remarks of yours. I'd like to thank this initiative and immensely to the organizers who have put us here. They faced several challenges today in this such spectacular city, which is this virtual city of health. And I once again invite you to get to know it and serve this city. And I'd like to share with you a phrase that I heard yesterday from Pedro Parente. It's not his. He said it was not his. He was very inspiring yesterday. He said he's the former Petrobras chairman, the man that takes the bag of hope and the bag of experience has to always work. And women, to me, is the same thing, because she can carry those both bags on her shoulders. That hope be always the stronger bag regarding experience, that she never becomes heavier, that these challenges and journeys be light to us that are passionate for healthcare, technology, and this world of women that is adding to the world that existed before, that is no longer at this moment the same world. Thank you all very much.